Good morning, friends. We welcome you to our high impact channel, Manovijnanam Dr. D.V. Ramanamurthy, PhD Official, powered by Ramadevi Foundation, Hyderabad. Hello, I am Dr. D.V. Ramanamurthy, PhD in Management, formerly Professor and Dean, presently Founder Director, Attitude Positive, Behavior Management Training Solutions, Hyderabad. Friends, today in this video podcast, we would like to discuss a very important burning point of a generation in crisis, a highly alarming situation across the globe. I request you to please watch this video till the end. Ladies and gentlemen, we are witnessing a crisis that does not shout. It does not protest in the streets. It does not break headlines every day. Yet, it is silently reshaping the future of our world across continents, across cultures, across economic systems. Young people are struggling at unprecedented levels. Anxiety, depression, loneliness, hopelessness. These are no longer isolated experiences. They are becoming defining features of a generation. This is not about weak character. This is not about poor parenting. And this is not about academic stress alone. This is a structural, technological, social, and psychological transformation happening faster than our institutions can respond. If we fail to act, we are not just failing individuals. We are compromising the cognitive, emotional, and economic future of our nations. Today, we confront the truth. Not to create fear, friends, but to create responsibility. Youth mental health, the silent global crisis. Across the world, a silent crisis is unfolding. 1 in 7 adolescents is living with a diagnosable mental disorder. This is not an isolated trend, nor a cultural anomaly. It is a global phenomenon affecting 163 nations across the globe. We are not witnessing teenage mood swings. We are witnessing a generational mental health emergency. The inflection point between 2013 and 2023. The data reveals a clear inflection point around 2013, coinciding with the widespread adoption of smartphones and algorithm-driven social media. Since then, persistent sadness among teenage girls has surged dramatically. This pattern repeats across continents, cultures, and economic systems. Please note that this is systemic. Look at the root causes, a perfect storm. We are confronting a perfect storm. Hyperconnectivity has paradoxically produced isolation. Algorithmic comparison cultures amplifies inadequacy. The pandemic disrupted formative social years. Economic uncertainty fuels anxiety. Climate change and geopolitical insatiability weigh heavily on Gen Z. This crisis is multi-layered and structural. Look at the most vulnerable. Adolescent girls are disproportionately affected, but boys are not far behind. 75% of the lifetime mental health disorders before age of 25 begin before the age of 25. Suicide rates among youth have continued to climb in several regions since 2015. The developmental window is critical. and it is under threat. Let's look at real-world consequences. The crisis extends beyond emotional distress. Emergency room visits for self-harm have doubled in some regions. Nearly 65 million young people were unemployed in 2023. Mental disorders cost the global economy $5 trillion annually. The human cost is lost potential, fractured relationships, diminished hope is incalculable. What are then the system gaps? Despite rising need, nearly 40% of young people requiring mental health services receive no support. Schools lack adequate counseling systems. Stigma silences help seeking. Workforce shortages limit access. We are facing a demand-supply imbalance of historic proportions. What are then the strategic interventions? Solutions must be multi-tiered. Policymakers must prioritize early intervention and digital safeguards. Schools must embed mental health literacy into curriculum. Families must model balanced technology use and foster open dialogue. Prevention is not optional. It is very essential. Now, a call to leadership. We stand at a defining moment. Mental health is not a privilege for the few. It is a fundamental human right. A generation is struggling, often invisibly. Leadership today will determine whether we inherit a resilient generation or a broken one. The time for awareness has passed. The time for action is now. Now, my final words. We cannot afford to normalize distress. When anxiety becomes culture, when loneliness becomes routine, when hopelessness becomes silent, we are not witnessing individual weaknesses. We are witnessing a systemic failure. History will not ask whether we had the data. History will ask whether we acted on it. Every policy delayed, every conversation avoided, every warning ignored has a human face behind it. Mental health is not a side issue. It is foundational to learning, productivity, leadership, innovation, and democracy itself. So if we protect the minds of young people, we protect the future of our nations. The time for awareness is all over. The time for leadership is now. Thank you for your patient listening, for your kind attention and time. If this video resonates with you, kindly press the like button and share this with your friends. If you have anything to share, please put your ideas in the comments box and kindly subscribe our channel Manovijnanam Dr. D.V. Ramanamurthy, PhD official, powered by Ramadevi Foundation, Hyderabad. See you in the next insightful video. Until then, take care, keep smiling. Good luck.